Hi everyone, my name is Dylan Cooper. I am a current medical student at the Zucker School of Medicine, class of 2024, and Dean's Research Fellow at the Northwell Health Cancer Institute.
My name is Brittany Sue, and I am a fourth-year medical student at the NYIT College of Osteopathic Medicine at Old Westbury.
I've been interested in cancer research since I was a high school student when I spent a summer in Boston working in a viral oncology lab at the Dana-Farber. And I had been privileged to receive really strong mentorship there, which was especially critical for me as a wide-eyed high school student who just learned the phases of the cell cycle and the structure of viruses. So fast forward about 10 years or so later to medical school, I had done some neuroscience research in college, and I wanted to devote a year to cancer-specific clinical research as a medical student. And I had gotten connected to the Northwell Health Cancer Institute, and with their full support and collaboration, we were able to establish a paid research fellowship for medical students that has embedded within it clinical opportunities and mentorship, and also the ability to pay that mentorship forward to pre-medical students and research coordinators who are building their CVs for medical school admissions. And we're actually actively recruiting for this coming year, so we'd love to share this fellowship opportunity with current medical students who are interested in devoting a year to research.
I am most proud of my externship at the Northwestern Shirley Ryan Ability Lab, where I was able to integrate clinical practice with health outcomes research. As a medical student, I worked with the physical medicine and rehabilitation patients in the hospital and then used their data to analyze which bariatric patients required more support and assistance to improve their walking distance outcomes. I was then able to present a poster at the 2021 American Association of Physiatry annual meeting. I find this type of research the most meaningful because I am directly impacting the lives of my patients, and it is the type of work that I hope to do in my future career as a physician.
Someone who has had an impact on me through my medical journey is my uncle, Dr. Donnie Emerson. He always reminds me of the humanistic side of medicine that exists for both patients as well as for providers. Just as our patients have lives outside the moments that we see them in clinic or at the hospital, we as doctors and future doctors also have lives outside of medicine. Uncle Donnie loves painting and swimming and running and biking and hiking and always makes time for his family. And while he's a retired radiologist now, he made sure to prioritize life outside of medicine while not compromising his clinical responsibilities and resident and fellow didactics. And I think that reinforced his clinical acumen and informed his ability to have deeper patient relationships. So as I progress through my career, I think of Dr. Emerson often. Physicians are humans too, and it's important to not lose sight of that.
A mentor that has influenced my medical career is Dr. Jane Chow, a cardiologist and director of research at St. Francis Hospital in Roslyn, New York. I worked with Dr. Chow prior to and for part of medical school as a research analyst. As a non-traditional student, I had some fears about pursuing medicine, and Dr. Chow always encouraged me and believed in my potential. She supported me during the medical school application process and gave me advice during school. She taught me how to think critically from both a physician and researcher perspective. I still carry the problem-solving skills and persistent mindset that she has taught me and will continue to for years to come.
When my friends and family ask me, "Hey Dylan, what kind of doctor do you want to be?" I often will respond, "A darn good one." I want to be a competent doctor who cares for his patients, doesn't rush through clinic, and has the humility to admit when I'm wrong. My focus this year has been on head and neck cancer research. For background, head and neck cancer global incidence has increased over the last few decades and is projected to continue to rise, largely driven by increases in oropharyngeal and HPV-related cancers. So we're in for the long haul with this disease, and I'd love to have a career focused on preventing and equitably treating these patients and researching ways to improve outcomes and quality of life metrics for these patients in the future.
I hope to pursue a career in primary care outpatient practice in a community health center or FQHC. I am particularly drawn to underserved communities where I can help patients with socioeconomic barriers to care and to improve health education initiatives. I enjoy providing continuity of care and would like to be immersed in the community where my patients live. I will bring the skills that I learned in my year with AmeriCorps to develop effective health educational programming and community service projects. I also hope to continue doing community-based and health outcomes-based research to improve the quality of care that my patients will receive.
Wishing everyone a happy and healthy holiday season and a joyful new year.